start with you, Dr. Agarwal, because you recently talked about mixopathy and how, the government should not be emphasizing that, and, you think that they should take their time over that. Talk a little about that.
See, there was a suggestion by some Niti Aayog to the government regarding the mixopathy, teaching all kind of pathy at the undergraduate level. But definitely we discuss with the government, and the government is not there, on record they said that they have no planning to bring that other pathy education with the combining with
To mix
yes,
the
yes. So
disciplines.
now there is nothing like that. Only thing what they are telling in the induction program, they are telling the students the entire pathy is available in country. So that is fine with us. So knowing about what are the existing pathy in the country, I don't think that there is any point. But now there is no planning to mixing it with the medical education.
I think that's quite a relief.
Yes, yes.
But medical education is still a hostage to a whole lot of issues, and I think one of the main issues is that perhaps we don't have enough doctors, trained doctors in the country, and trained nurses, in fact. So a little about that, and then I'd like to bring the two of you in as well.
See, we all know the deficiency in the medical doctor in our country.
Yeah.
And as we know that last 10 years and after this regime, lot of new medical college has been brought into this thing. The only thing which we are worried about the quality of medical education. There should be some process, and yes, I'm sure that MC and the government, they are serious about that. We have wrote so many times, and so many times we have met the health minister and the MC. We suggested that the standard of medical education has to be maintained, and all the medical colleges should have a uniform education standard. Otherwise, if we don't fix the standard and standardize the medical education, the output will not be the same. And that is very important, because whoever is coming as a doctor after completing MBBS, they are going into society and treating the patients. So that is very important, and I am happy that government is, yes, though a lot of things has to be improved, but their intention is good and they have start working on that direction. That is good.
Could I bring you in, sir, and talk about the gaps that are there in the training of doctors and nurses, the two in particular?
Yeah. Medical education is at crossroads today. Though we recently had the introduction of a new curriculum, that is competency-based medical education,
Yeah.
still there are some issues facing medical education. For example, it was 2019 when it was introduced. We need to know how it has fared. We find that still there are gaps between the actual curriculum taught in the medical colleges and the societal needs. So this gap has to be bridged. That is one thing. We need to tailor our curriculum as per the societal needs, in which wherever the present problems that the public is facing, those issues have to be raised, like malnutrition, anemia in women. These are all things which are ever prevalent. We are not addressing those. We are teaching students, we are giving them knowledge. Of course, now there are emphasis on skill-based learning as well, competency-based, and that is assessed. But we need to also talk about the current issues that are very relevant, which need to be taught to the students.
Right, which are?
As I mentioned, the tuberculosis in India, leprosy in India, the malnutrition,
We don't have
anemias.
enough trained personnel for that.
No, our curriculum is not designed to that level. We do teach them,
Right.
but the actual practical thing and then the skills they need to tackle these things are not taught.
Right.
That is tailored to that.
Dr. Sudha, where are the gaps?
I would like to enlist, to start with, the gaps or issues which are currently prevalent. So I would start by saying, number one, rural India still does not have adequate access to quality healthcare facility. Number two, there is a necessity, considering all those factors on ground, there is a necessity to revive the concept of a family physician.
Right.
In other words, the family physician needs to be
Absolutely.
resurrected. And number three, handling patients singly in a rural setup is completely different from handling patients with somebody behind you, somebody supervising in a well-established setup.
Right.
I think these are the areas where medical education needs to be advanced and train the Indian medical graduate to handle a situation on ground,
Right.
all by himself or herself, without the help of gadgets, without the help of scans and radiological investigations immediately on hand.
Right.
So this has to be a development of the competency. No, Dr. Sachi was talking about the competencies. We have something called the competency-based medical education. But then how much of competency is really achieved? Like, okay, I know to take the blood pressure.
Yeah.
I am given a kind of, some marks and I'm given a pass in the physiology examination. But then when I go to the ground and start taking the blood pressure for a patient all by myself, I would still not be comfortable.
Right.
So some kind of intensive hands-on, intensive internship, that needs to be given. The current internship pattern of 12 months is fine, but somewhere down the line, at least 3 to 4 months will have to be a real intensive hands-on on the ground.
Right.
And we also need to kind of strengthen our postgraduate education in terms of the family medicine system. And there is a necessity to revive the entire family physician concept.
Right. Talking about the rural setup, the primary health centers are mostly still in a shambles. And I think the government had a plan to create wellness centers. I don't know what has happened to that.
Some
But,
work
yeah.
is happening on that line. But, as was rightly discussed earlier, the proportion of medical personnel available to the general population. If you take a state like Tamil Nadu, the statistics given is, one doctor per 300 people or so, 243 something in Tamil Nadu, and then it kind of, keeps going up, Karnataka, Kerala. But then if you go to places like Haryana and Jharkhand, one doctor available for about 6,000 plus population. So that is where the gap is, and probably it will take quite some time to, even if you have that number of medical schools and then churn out that many medical graduates every year, whether these people will be motivated to really work on the rural setup. So I personally feel, I've been with the Tamil Nadu Medical University for 4 years, and Sachi and I had been colleagues, but I personally feel something has to go into the curriculum where the prospective Indian medical graduate is kind of, motivated to work in the rural setup.
Yeah.
Some kind of value-based education, maybe, at the ATCOM level or at the yoga level, at the orientation level, somewhere we need to put in that
Can
kind
it
of a
not
thinking.
be made mandatory?
You can make it mandatory, but then just by making it mandatory, would it have the desired effect?
You think
It
not?
would be there on paper, but then working with all your heart and soul is something different. And remember, these are people who will have to handle patients.
Yeah.
I cannot just be reflecting my moods, my ups and downs on the patient.
Right.
So that requires a kind of a balanced approach, and probably in the medical education, this needs to be incorporated and brought in.
Right. Doctor, what do you think? How can this be encouraged in the students? Because as it is, you find fewer people wanting to get into the medical stream because they think it takes too long and it's too intensive, and engineering is perhaps more glamorous.
Yeah, as it existed, medical education was knowledge-based teaching. We used to teach theory to the students,
Right.
and very limited time was spent on practicals and this thing.
Right.
So that should change. It was knowledge, it was skills, and then attitudes. Now I would like to reverse that. What we need to concentrate is on attitudes, skill, and then knowledge.
Right.
That way, as Dr. Sudha mentioned just now, we would be training our students to interact very well, communicate very well with the patients, rather than show off his knowledge and things like that. That's one thing. Secondly, we want doctors who does rather than doctor who knows. We should prepare our young doctors to have that skills, develop that skills. So I can completely concur with her that we need to train students towards skill development.
Right.
May I add something here?
Please.
I had a professor, I wouldn't want to quote the name, my professor. There was one situation where I had handled a post-operative patient with a particular drug. I was not aware that my professor never liked that particular drug because of some kind of bitter experience he had in his own internship days. Not knowing the fact, I used it. The next morning, I could see the reaction of the rest of them, the rest of the unit. They were, almost kind of telling me, I'm gone forever. And that is what was expected from the professor. If he only knew that I had used that particular drug, God knows what will happen. The heavens will come down and Himalayas would break loose and all that. But then he came and I went straight to him. I told him this is what I did. I didn't know, but then the patient is fine now. He just had one statement to make. He said, I prefer a complicated patient to someone who would not be alive the morning. That was his take. He said, I don't mind. She used it. She didn't know. She used it, but then the patient has survived.
Right.
If only she had not used a drug just because I did not like the drug,
Right.
I might not have the patient
Alive.
in life and death, in life and flesh this morning. So I would prefer this. So that is the kind of attitude you would have to have. Go down. You would have to save your patient or you would have to do what is required for the patient, and that is wholly dependent on the attitude and not on the qualification or the number of years you spend and things like that. And I also have, on the personal front, I feel judging medical education by the number of years spent in the medical school and trying to say an engineering graduate would earn at the end of the fourth year, but a medical
those are
graduate.
the calculations of parents.
I think that
isn't
should
it?
not be there. That something has to be done.
Right.
Either it's the parent or the
Or the
grandparent
child.
or the peer pressure, whatever you call it. I think that's not the right way to compare things.
Right.
There's no comparison.
Yeah. May I ask you to weigh in on the NEET issue, because as you know, that's one of the biggest issues in the state. What's your take on it, sir?
Next,
NEET.
NEET.
The NEET exam.
What's a NEET exam? What you want to know about
No, there is a lot of backlash or pushback from Tamil Nadu to the idea of NEET. They don't want that centralized exam.
that? No, see, NEET is good exam. You see, initially you see what every individual after 12, they used to go to place to place.
Individual medical college.
Yeah, to give the entrance exam. Now there is a uniform exam. I don't feel that. See, what we say what is good as per the professional, and we don't know the politics. So what the political people do, they have something else. But NEET is good. Central exam, the student is tension free, less stress. They have to prepare for the single exam. Exam is good, NEET is good, there is no problem in that. Only thing, the counseling part should need some improvement. Like state has a different counseling, center has a different counseling. And I know that government is working on that there should be a single software. And from there, single counseling, if a student want to take seat in the central quota, from central quota, should be allotted from central quota. If want to take from state quota, should be allotted from. Otherwise, it takes lot of time, rather months, to get finalized the fill up the seats. But I want to mention another important thing around the medical education. See, the biggest problem is, probably Shad, you also reported that 50% medical college, they don't have the sufficient faculties.
Right.
And that is very important. We are very happy that now we have 711 or 12, whatever, medical colleges producing 110,000 students. These all are the, indicators. You can make so many indicators. But actually, if you see the medical college, they don't comply. After NMC, what happened? On a single application, affidavit, you are allowed to open up the medical college. Initially, there was a necessity to start a hospital for 3 years.
Right.
Now that has also abolished. Even if you want to open up the medical college, you go and put the application, you will be allowed. You are given the time, okay, you by this time, these are the landmarks which you have to achieve. Nobody is going and checking what is happening till 5 years. I tell you as a national president, the government medical college, I am talking about the government, not the private. 3 government medical colleges, autonomous medical college student after internship, they were denied to register by the State Medical Council because NMC has suddenly waken up and took the inspection and find that there are lot of NCs. And the student who have completed the MBBS, completed the internship, were denied for the registration by the State Medical Council. Where they will go? Neither the institute were able to help them or nor anybody else. Those poor students, they came to us in Indian Medical Association office, Delhi, and they were literally weeping in front of me that where do they go? They are on, again, after spending 5 years, they are on the square one. Then I wrote to the health minister, I wrote to the chief minister of that state and the NMC chairman. What is this? Why should they be sufferer? If you want to take, why didn't you took the inspection before the exam? Why are you now doing the inspection and rejecting those medical colleges, and what will those 300 students? But thankfully they listen to the Indian Medical Association and immediately they get everybody registered there. But see, this should not be the individual dependent. There has to be some SOPs. Like they came to the Indian Medical Association and the national president took
so it's all very arbitrary.
that is absolutely wrong. There has to be some SOPs. Yes, these are the landmark. These are the time when we'll go the first checkup,
Right.
the second checkup, and they should ensure this. You see, you are the newspaper. You do the some survey across all the corner, not on the one particular state, and see what are the fallacies. They are not having the appropriate faculty there, and slowly and slowly they are keep on minimizing the eligibility of the faculty per student, because to compensate this shortage. This is also wrong.
May I ask you to quickly...
I'll go back to NEET and then come to this. As you rightly said, NEET is a good exam. It saves the de-stresses student. It saves the trouble of the student writing many exams, and they write one exam, and it's a level playing field. But my personal opinion is equal importance should be given to board exam as well. Like we had earlier, CET, they used to take 50% marks from the board exam, 50% from the entrance exam. That would eliminate 2 things. One is, it will eliminate the coaching classes.
Right.
The stress and this thing, money spent on NEET exams, training the students to appear for that will be taken away. Second, importance is also given to board exams. Otherwise, students start neglecting that. So this is what is required. NEET is good, one exam is good, give equal importance to board exam. That's true. Secondly, as I said about the faculty deficiency, that's only because that has arisen because of the fact that in the last 10 years or a decade, number of medical colleges have risen. It's almost doubled now. It's about 712 colleges at present, which was around 400 or 350 or something just 10 years ago. So this rapid rise in the medical colleges has given rise to, deficiency of faculty. That is one thing. Secondly, the faculty positions and the teaching profession is not attractive. It is not attractive because the salary given to these doctors are very less. After having put because MD is minimum, MD/MS, which means that he'll take around 8.5, 9 years for the doctor to graduate, postgraduate, and then he gets a very less salary. So it is not attractive at all. The NMC and think tank should think about this thing. They should make it more attractive and try to attract more young doctors. That's one thing. Secondly, they should be trained and then allowed to get into the colleges.
Right.
There is no formal training at all. These two things should be addressed.
Yeah. Dr. Sudha, closing thoughts?
Yeah, I think NEET, much has been told, and as rightly told by Sachi, it has to be a balance between the qualifying examination and the kind of
bodies.
training, because intelligence is something that can be trained.
Right.
So questions or, the exam should be based on the qualifying examination or the content that goes into the qualifying examination. Now, with regard to the inspection formalities, the number of medical schools and all that, one major issue is inadequate faculty in almost all the preclinical departments. Like, the preclinical departments, especially anatomy, physiology, biochemistry, microbiology, not many takers. And you would have seen last year in the postgraduate selection, even those who had scored 0 percentile in the NEET were given seats, were given the postgraduate seats in anatomy and physiology. So somewhere the salary will have to be hiked up, number one. Some kind of social security and social status. Dr. Sachi, I would even go on to say the preclinical colleagues are not even respected by their own clinical colleagues. So that's one, kind of a discrepancy that prevails within the system, and that has to be addressed by people who are responsible for running the system.
Wonderful. Thank you so much. We're out of time, but thank you very much. I think we've managed to address quite a few things within the short time. Thank you.
Thank you so much to all our speakers on stage. A loud round of applause, ladies and gentlemen. At this